It is my pleasure to welcome Dr. Zahar, a professor of medicine and interventional cardiologist at OHSU. Today, we'll be discussing his JACC interventions manuscript, assessing the impact of tricuspid regurgitations on outcomes of TAVR with balloon expandable valves. Dr. Zahar, thank you so much for taking the time to join us and share your expertise.
Oh, thank you so much for having me, Abdullah. It's an honor and pleasure to be with you today.
Thank you. Dr. Zahar, first, can you give us a brief background about the topic and the questions that you and the team aim to address?
Yeah, this is a topic that has been, going in our mind for a long time, right? How we manage patients with multivalvular heart disease. And in the era of surgery, the answer was, relatively straightforward. You operate on them at the same time, or you don't, and which you operate and which you don't operate. But most of the time, you address it at the same time with surgery. With a transcatheter, now you have the luxury to do it one at a time, especially in patients who are high surgical risk and are suitable for multiple transcatheter valvular intervention. So understanding what happened with other valve disease after you fix one valve disease is going to guide a lot of what we do in the future about the management of the complex, yet becoming more common patients with multivalvular disease. So this is the background about where this idea come from. And what we have done is trying to figure out in right now the most commonly done transcatheter valve procedure, which is TAVR, what happened with patients? How many patients of those will have TR, significant TR, severe or greater TR? What happened to TR after TAVR? Do they improve? How many of them will improve? And who are those who improve? And finally, what is the long-term outcome for those who do not improve? Does have a negative mortality signal. And this is of extreme value at times where we have two approved transcatheter tricuspid therapies.
Yes, absolutely. And I completely agree. And especially it's a thing that we deal with now on a daily basis with these patients with multivalvular disease. And, kind of, to be honest, we want to move right into the results. What did you guys found? What happens to these multivalve disease at the time of the intervention?
Yeah, so the beauty about, a TVT registry data is a large, cohort of data. And we got what we, in a way, we got what we expected to see, which is the majority of patients with severe AS have mild TR. But also, reports have been varied before about what is the prevalence of severe TR, and it's not insignificant. There is, some patients will have severe TR, and in our cohorts, it's 3% of patients, and this is a large TVT registry, have, severe TR. So when we propensity match the group, for risk, I understand when you propensity match, you tend up with a little bit higher risk group of the mild, TR. And we looked at what happened with the 3-year mortality with those cohorts. And those who have severe TR, yes, they are the minority, but they have the highest mortality, even when you match for all of the other variables. So I think that this is an important finding that we identified a group that those who have severe TR at baseline, and more importantly, those who TR did not improve after TAVR to be the highest risk for mortality up to 3 years.
Agree, and I think that's a very important kind of first step that we prove that these people do worse. And what happened to the TR in general, especially with those with severe TR? Did the majority stay with severe TR? Did things improve? How did things look post TAVR?
Yeah, obviously we're in the field of multivalvular disease, and a lot of people said, well, what is the implication of MR? Because MR or TAVR has been a dynamic duo for a lot of investigation. What we have found is regardless of what degree of MR you have, severe TR add to the mortality. So for those who have mild MR, moderate MR, severe TR increase their mortality. So it is independent of the degree of MR. But we've also found is those who have MR because of loading condition, their MR improved after TAVR, obviously, but their TR improved after TAVR. And the majority of the TR in our cohort actually improved over TAVR after TAVR. However, there is a cohort of patients that the TR is not necessarily load dependent. Those who have, pacemaker, those who don't have necessarily a high gradient across the aortic valve. Those TR tend not to improve. Those who have, kidney problems, those TR tend not to improve to the same extent that other patient population with severe TR improve.
And again, I think it's very important to kind of see what happens to these patients. But how do you think we should incorporate these results in clinical practice, at least from your perspective, and how do we move forward with this?
Yeah, so I think there are many take-home messages, and again, we live in an era of approved transcatheter therapies for tricuspid valve as well. I think one that severe TR should not prevent us from replacing the aortic valve. It's still very important. First valve need to be addressed is the aortic valve. Two, for those who have severe TR, many of them, their TR improved after TAVR. So in a way, we have to wait for after TAVR to judge whether or not the TR need to be addressed or not. And three, those who continue to have severe TR will have increased mortality up to 3 years. And to put it all together, I think that this is the exciting moments of the field, that I cannot say what we need to do with those patients, but maybe this is what we need to focus on in multivalvular disease, about who from this patient population we can alter their mortality, their long-term mortality, by addressing their tricuspid valve.
Awesome, and completely agree. And thank you so much, Dr. Zahar, for joining us, explaining, going over the paper, the results, and future perspective. And we invite everyone to go over the full manuscript published in this issue of JACC Interventions. Thank you again, Dr. Zahar.
Thank you so much. I appreciate you having me, and I hope this paper add to our understanding to the complex valvular heart disease patient management.
It definitely does. Thank you.
All right.